Shopify grows your business no matter how far or big you grow. Shopify is the global commerce platform that helps you sell at every stage of your business. Whether you're selling your fans' next favorite shirt or an exclusive piece of podcast merch, Shopify helps you sell everywhere. Shopify powers 10% of all e-commerce in the U.S. Allbirds, Rothy's, Brooklinen, and millions of other entrepreneurs of every size across 175 countries. Plus, Shopify's award-winning help is there to support your success every step of the way. Because businesses that grow, grow with Shopify. Sign up for a $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income now to grow your business, no matter what stage you're in.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we have a pretty hot topic, tongue tie. Now, back in December of 2023, there was an article in the New York Times all about tongue tie. It definitely caused some controversy. And I wanted to better understand why there is controversy around this and what exactly is tongue tie and how does it get resolved? Does it need to get resolved? What problems does it cause? So I got to the bottom of this with an amazing person. Let me tell you a little bit about Stephanie Heintzeler. She's a German-educated midwife and acupuncturist, as well as a U.S.-educated birth doula and lactation consultant at IBCLC. Stephanie knows a lot. She comes with a lot of knowledge. So I thought I'd reach out to her to get to the bottom of this tongue tie conversation. And she really unpacks a lot of that. I think if you have any question about it, if you've heard about it, you're like, is it good? Is it bad? What do we do? Do we not do anything? Stephanie really answers these questions, and I'm excited for you to hear that. Before we get to my conversation with Stephanie, I always love to give studio updates. So as you hear this, we are approaching our big free online birthday celebration class. So this is our 22nd birthday, which is pretty amazing and something I'm so proud of, something that all the teachers have been part of for the last 22 years, the community has built. It's not just a celebration of the vision I had of PYC 22 years ago, but it's the manifestation of all of those who have been part of PYC for the last 22 years. So, and all the generations and hundreds, thousands of babies that have been part of this community and the parents. So I want to thank all the community members for making us what we are. It really means something to me. So here we are in the summer, continuing to move forward. We've got our online classes, our in-studio classes, our workshops, our on-demand workshops, our teacher training. We're revving up for our next year's worth of teacher training, our prenatal yoga teacher training. So all this information, if you are curious, is on our website. So you can dig in, check out the website, all our free videos, our blogs, all about the teacher training, all about our classes. You can check that all out on our website, prenatalyogacenter.com. And then as always, just to thank you for listening, and what would be really wonderfully appreciated if you can take a moment to leave a rating and review for the podcast. It helps people find us, and then we can continue to support each other through education and wonderful conversations. All right, that's enough from me. We're going to take a super quick break, and when we come back, please enjoy my conversation with Stephanie Heintzeler. Hi, Stephanie. How are you?
Hello, Deb. I'm very well, thank you. How are you?
I'm doing great. I'm actually really excited to chat about this about tongue tie, because it's something I don't know a lot about. And when I heard people asking about it, I immediately thought of you. I'm like, Stephanie's going to know. So I'm super excited, but just fun. Just like a little fun fact in my head is as we're sitting here recording, I just think it's funny that I'm sitting here at home and yet you're at the studio right now. You're at PYC.
Yep.
Usually the reverse. I love that. I love that you're offering your services there. So that's great. All right. So I know you already, but I'd love to learn a little bit. I'd love our community to learn a little bit more about you. But also, can you talk a little about your very impressive background coming from Germany as a midwife and IBCLC and a doula? Like you have a lot of knowledge there. I'd love to learn
Thank you
more.
very much. Well, yes, I've basically a background from various countries, basically. So I've been a midwife since the year 2000. Always wanted to be a midwife. Started my first internship like early 90s when I was 17 years old, just
Oh,
because I
wow.
just knew I want to be a midwife. And so I've been in this field a long time, and did midwifery for a long time. And when I moved to New York, I was looking into becoming a midwife here, which would have meant just going back to school for another like 18 months, I believe, and or possibly becoming a birth doula. And I was like, you know what, let me look into the birth world here, what it looks like. And so I started doing birth doula work, and I loved it so much that I've been doing it ever since. And I also did quite a bit of postpartum, and noticed that some people were having issues with breastfeeding. And of course, I knew a lot as a midwife, but then sometimes things were missing in terms of maybe the latch or the anatomy or just certain things. So then I decided to first become a lactation counselor, and that was not enough. And then I moved on to becoming a lactation consultant. And I just loved it because I think I did my certification 2017, and there were just so many aha moments. It just filled all the gaps that I had, every little thing where I just wasn't sure how to help. And sometimes we figured it out, but it just was really nice to see that there is sometimes a clinical thing that we need to look into, or maybe a nutritional thing, or an allergy, or a muscle that needs to be trained, or whatever it was. And that was really nice to learn. So now I do all of that, lactation consultations and birth doula support. And I run an agency called the New York Baby. So I train doulas and work with doulas and send them out, and night nannies as well. So it's really amazing to work in New York City with expecting families. I think it's just lovely.
I love the knowledge that you bring because it's so different. I was a labor support doula for a little over 10 years, and I felt like, okay, I was pretty well educated. I understood what was going on. But the fact that you come to doula work with a midwifery background, wow, like your clients are really, it's special and lucky because you have a different, I know you can't give clinical advice that way because it's not under kind of that,
Yeah.
what a doula does here in the States.
Yeah.
But the fact that you do have that insight, I feel like your clients are just so lucky to have that
Yes,
sense, like you
for
really.
sure, for sure. Oops, excuse me. Yes, what I really enjoy about
Give it
that.
1 second. Give it 1 second so we can cut that.
Yeah.
All right. Just count to 2 in your head.
Yeah, what I really love about that is knowing where the medical team is coming from, not even telling people what I would do or what I recommend, because often it's their decision, of course. But I can always explain why a doctor or midwife recommends this or that, and that helps tremendously. Plus, I mean, there are still births in New York City where it's so busy, there's nobody there, or the doctor thought it's going to be a while. Meanwhile, the baby is coming, and I still get to deliver a baby like once a year or so.
I was going to ask, how many times have you caught a baby? Wow.
Yeah. And it's just, I just really, not that I like love it, because in the moment it's usually like, where's the nurse? Like, can someone come please? But at least I know what to do, and the moms are relaxed about it. And it's certainly helpful. I think every doula, right, has caught a baby at some point.
Yes, I did not. It was very stressful. I had actually just come back from a midwifery course at the farm. So I had some knowledge, but it was definitely not the role that I had signed up for. And I'm like, I hope I'm doing this. It turned out great. But yeah, I think all doulas in some way or another have ended up catching a baby. But yeah, you definitely at least have the skill for it. All right, so I'm going to turn us to the topic of tongue tie. It is such a hot topic. I know that recently, a few months ago, there was a big article in the New York Times about this, which kind of sparked my interest in diving more into it. So let's start with, what is tongue tie?
So tongue tie, the medical term is called ankyloglossia, which has to do with the tongue. It's basically a condition where the tongue is attached to the floor, to the floor of the mouth by a short or thick or a little bit tighter band of tissue. And this tissue is called the frenulum. And we have one of those up on our lips, between the gum and the upper lips, and then, of course, lower lips as well. And then we have a thicker one, which it's supposed to be thicker, but it's under the tongue. And sometimes it's a little too thick or too long, meaning, although we say, funny enough, we say it's a short tongue tie, but it means that this like little fan-looking tissue is going from the depth of the tongue all the way to the middle of the tongue, or maybe the tip of the tongue. And people who have a tongue tie, they may or may not have issues. Sometimes, like adults, when they ask me what it is, I say, can you flick your tongue? Can you do this movement? Can you get the back of your tongue up to the roof of your mouth, top of the roof of your mouth? Can you stick out your tongue, and how far does it go? So these little things for adults can work quite nicely to figure out, what is this? What are we even talking about? But the main thing is, because of that tie, depending on how it presents itself, it can limit the tongue range of motion. And then because of that, it can cause a variety of issues, big or small. But the main one we are looking at as a lactation consultant is breastfeeding, right? Breastfeeding issues.
What about lip tie? Is that the same thing, that little, as I try to do it, like that little piece at the front of the lip to the bottom of the gums? Is that the same thing that can get problematic?
It can cause issues, because sometimes when it's very short, this little tie between the upper teeth basically into the lip, sometimes the baby can't flange out the lips properly when they're on the breast. Even on a bottle, like we try to like flange out the lips so that they have a fish mouth position. And sometimes that doesn't work when it's super tight. I want to say it's less often that it's that tight, but people can examine it on their own. This is even easier to examine because the lip gets a little white because it gets stretched out when we try to flange out the lip, and like the top or bottom lip, and then it gets white or really looks quite stretched. Then it could be an upper lip tie, which doesn't always mean anything. We always want to look at the big picture.
So why? It sounds very straightforward, and I bet everyone else that's listening was doing exactly what I was just like, how far can I stick my tongue out? Can I take the back of my tongue to the roof of my mouth? I bet everyone is doing that. But it sounds pretty straightforward. So why is there such controversy around tongue tie right now?
Yeah, it's an issue that or topic that has come up more and more. I think on one hand, it's more, people know more about it. There's so much out there, so much to read. There's more books like Tongue Tied, a book by Dr. Richard Baxter, which I like, looks at like the evidence on all that. There's more education. But at the same time, there are people who are breastfeeding who really want to breastfeed and who are having issues, and then get a lactation consultant. More insurances now pay for a lactation consultant. So then it gets diagnosed more. At the same time, there's articles, and the most recent one was the one in the New York Times, I believe it was last December, where the Times just tried to pick on the other side, meaning that it's being overdiagnosed or unnecessarily treated, and really looked into what could go wrong if the tongue tie is being treated. Meaning treatment is usually, it's being cut with a little scissors or with a laser, it's being lasered. It's called frenotomy. That's the procedure that's being done. And this procedure is costly. It's not always paid by insurance. Sometimes breastfeeding doesn't improve, but most of the time it does. But the Times picked people where it didn't go so well, which, I mean, I think even if there's a 0.001% rate of being, putting serious harm on a baby, those were the families that the Times picked. And what I really didn't like is they chose an IBCLC, a lactation consultant from Idaho. They had to go as far as Idaho to choose an IBCLC who had like a bad reputation, basically. And they chose her for this article to like explain how terrible lactation consultants are, right? And that was something where it was like, okay, you pick on people in the city, but then you choose an example from Idaho. That just didn't make sense, right? And the controversy was also, of course, that people might push for a little surgery that is being done on a little baby, right? Which nobody wants that. Nobody wants to harm a baby. Nobody wants to do something on a newborn that is not really necessary. especially when it's like cutting a lingual frenulum or, helping with the mobility of the tongue. But it really was something that it's so emotional. I think that's the main reason why this article became so big, because it's such an emotional thing. Yeah.
I can imagine the stress around it. So you're a new parent, you're trying to establish breastfeeding. There, when the baby is not being fed, there's a lot of fussiness, and then the parent wants to do it. And I can see the stress mounting. And
Mhm.
then to be told tongue tie and then having to get it done, I could see how it is incredibly emotional.
Yeah.
So, what are the downsides to getting it? Because you said that a lot of babies that get this improve upon their breastfeeding, but what in some some don't because nothing's 100%.
Yeah.
We don't want to ever put a newborn in harm's way, so we'll all consider that. But should someone be told they need this? Is there a downside to doing it?
The downside is mainly in the moment, of course, discomfort.
Mhm.
So a baby gets this frenotomy, their baby is being held down for like a minute or so.
Do they
So
numb the tongue?
no, they usually numb, you mean?
Yeah, like numbing? Like, is there a
No,
numbing
for
agent they
newborns,
can do?
usually no. Because what's being said, which kind of makes sense, is like, well, to put an injection in a tiny little baby's mouth, it's being iced. So
That's
that,
true. Okay,
but
yeah.
then to give a little injection, numb the baby, that's another harm. And then the frenotomy is still not great for the baby, right? Not enjoyable or anything. It's
Yeah,
very
yeah.
uncomfortable. So it's such a fast procedure that is, I think everybody out there recommends to just do it and then put the baby on the breast right after, right? So the frenotomy is
Okay.
a very, very quick procedure. The very, very low risk is, besides the baby, of course, not liking this, is bleeding afterwards, maybe infection, which I personally have never seen any of this. In the article in the Times, they had a couple of babies who had like some serious issues, like swelling of the tongue or whatnot. But it always depends, why is it being done? What else is going on? Who does this, right? Not someone who does this once in a blue moon, who doesn't know what they're doing. And of course, sometimes we don't know how babies react to certain procedures. I mean, we've had, especially my work as a midwife, most beautiful births where you're like, oh, everything is going great. And you're in the hospital, but you're like, oh, this could be a home birth. Beautiful, right? And then boom, something happens out of the blue and you're like, ooh, thank goodness we were at the hospital, because
Mhm.
it's so rare. But of course, every doctor always weighs in the pros and cons, and obviously every lactation consultant, but lactation consultants do refer out to pediatric dentists or tongue tie specialists to get a
So,
second
yeah, who
opinion.
is doing this? I'm guessing it's not like an ENT. I mean, like, who's doing
It's
the
yeah,
cutting?
it is sometimes an ENT.
Is it? Okay.
Yes, absolutely. It's sometimes an ENT who specialize. Like it should be someone who really sees babies quite a bit, and sometimes a pediatric dentist. Those are the two who usually
Interesting.
do
Okay, so
these.
not the pediatrician.
Rarely, some do it. I think it depends on what it looks like, where the baby is. There's certainly pediatricians in hospitals who are like, you know what, let's just do this right away, because clearly this baby can't nurse, and this tongue tie is up to the tip of the lip, tip of the tongue, and baby can't stick out the lip. So that way they do it right away. But it's so in the US, it's really usually more the specialists. In other
Mhm.
countries, I know, for example, Brazil, they clip a tongue tie right away after birth, and it's usually done either by midwives or the pediatricians or
Oh,
obstetricians.
interesting.
Yeah.
So what are the symptoms and how is it diagnosed? And I guess who's diagnosing it?
Yeah, it's different people diagnose it. So in the hospital, it's usually the nurse, midwife, OB, or then the pediatrician with the first exam. They check the baby, check the mouth, examine the mouth. They might already mention something, but then it's usually on day 2 or 3, the lactation consultant who usually do their rounds in the hospital. At least hopefully they do their rounds, and every family gets to see one. And by then, day 3 after birth, the mother might have already noticed there's some strange pain, or the baby seems to be clamping down, or just something doesn't seem right, or is this okay? Does this look fine? And maybe I just need to adjust something else. But the typical thing, like as a lactation consultant, we do when we come in is you do an exam. You can see there's a visible frenulum, maybe it's tight. We watch the baby's moves. How is the tongue? How does it look? Does it cup? Does it not cup? What happens when baby cries? We do a suck test, put the baby on the breast, see what the tongue is doing. Like I kind of peek into the corner of the mouth. We examine the palate, just the lips. Sometimes there's some ties, buccal ties, sort of in the cheeks. What does the baby do in terms of sticking out the tongue? How far does the tongue go? And then the big thing is the shape, which everybody can check that on their own. Babies who have a tongue tie, sometimes the tongue looks a little square. It doesn't really, there's no tip of the tongue. It's just square or even heart shape or like deep heart shape, like the middle of the tongue is clearly being held back, right? And then, so this was like the baby side, but then of course we want to listen to the mother if there's problems breastfeeding, maybe bottle feeding problems, pain with breastfeeding. Baby starts coughing on the breast, choking and clamps down on the breast. Maybe there's even nipple damage. Sometimes moms report on clogged ducts, like constantly issues. Baby can't really remove the milk. Maybe they get a mastitis here and there. They might hear sounds when the baby's on the breast, like clicking, like, right, on the breast. Baby makes like just really regular sounds for swallowing. And it sometimes might feel there's no real vacuum on the breast.
Mm-hmm.
And then we might even look into reflux or colics. Those are certainly signs of tongue tie as well. But in addition with other things, right? We can't ever say, oh, baby has reflux. It's probably a tongue tie, right? It's usually you want to look at other things. And then interestingly enough, I've been following a lot of like YouTube videos and trainings and all that. And what I really like to look into as well is adults who have tongue tie and who might.
Yeah, I was going to ask about that. Yeah. Actually, I want to go into that because my daughter gets speech therapy. And the speech therapist is talking to me about adults with tongue tie. I'm like, how is this not already figured out? All right, so I want to go into that. We're going to take a quick break and we come back. Let's go into the fact that tongue tie may kind of slip by newborn world and just keep being there for a while. Okay, we'll be right back. Okay, we're back. So that was something I wanted to bring up because the speech therapist, like, she asked me to do something with my tongue. She's like, you might have a little tongue tie. I'm like, I do? And obviously, I'm like, clearly not fixing it at this age. But she brought up that it's something that more minor ones can continue throughout one's life. And my thought of that is like, how did it slip by? But then are there ages? So we're talking newborn and breastfeeding, but could it go so unrecognized that it then becomes a speech problem for like little kids? Is that where
it can? Yep. So sometimes it's only really being diagnosed when the child or toddler has either swallowing issue, a little bit eating issues, doesn't gain weight properly, or then speaking issues. Then, child is a little older. Maybe I talk a little bit like this. The tongue is just not really moving, right? And so then it's easy to diagnose. And usually at that point, it's recommended to do something latest, right? Because before, and we'll dive into that later maybe, you just kind of see and try things out and whatnot. But with children who have a little bit of speaking issues, if this is so obvious, then it certainly makes sense to do something. The thing is, the older someone gets, the more painful it gets to release it. Adults who get the frenotomy, they really have quite a long-ish recovery that takes 2-3 weeks because the wound is just so much deeper, right? Oof. It's like a real big diamond wound.
Oh gosh, I'm like cringing as you say it.
It just hurts. But funny enough, adults that I know, some are like in the doula world or lactation, they just do it because out of curiosity and they think maybe it could help them. But then others who had no idea, they get it done. And there was a video recently where a few people talked about it and said, I've been walking around for 40, 50, 60 years with like TMJ or like joint pain, headaches, neck pain, just constantly this tension in their upper part of the head. Up to when they spoke, they had dysphonia, they had issues speaking for a long time. And over time, they learned there's so much tension in their mouth, and they figured this could be from the tongue tie. So they had it released, and every one of these people said they felt like things were just melting away. And one of them was
Oh.
crying. She was in her 60s, and she said, I can't believe, I'm so relieved, but then I can't believe I was suffering for so many decades and
Mm.
nobody brought this up, right? And people can even notice when you lift your tongue. I'm singing as well. I'm in a choir, so I do a lot of like tongue and jaw and mouth exercises. But when you lift up your tongue and you squeeze this frenulum with your thumb and your index finger and kind of stretch the tongue over that, like you put the thumb and index finger on this frenulum as if you want to squeeze it, and then you stretch the tongue out of your mouth, like as if you want to, um,
Uh-huh.
stretch the tongue, and then you kind of massage this little frenulum. Most of the time it's not so comfortable, right? There's kind of tension and sometimes it hurts, and that alone can just show that there's quite a bit of tension in the back of someone's tongue. And everyone has that, of course, especially people in our world. Like TMJ is not always from tongue tie, but if this is something that really causes a lot of issues, then it might make sense to see someone or to just start with exercises, right? Adults can do lots of exercises.
Yeah, I find it fascinating. Back when I was a singer, tongue tension was a big deal. I'm going to
Mm-hmm.
pull it back to newborn land since that's what most of our folks are listening. So, when might a revision make sense and when might it not? Because I'm guessing there are times where it's just not appropriate.
Yeah. So we kind of want to look at, are there symptoms, right? Is there a symptomatic tongue restriction or asymptomatic tongue restriction? And usually when I come in or when a pediatric dentist is being seen, there are some symptoms. And if it's a symptomatic restriction, usually I recommend, like if I come in and I think, there's clearly a tongue tie and we do see any of these issues, right? And it's usually not day 5 after birth. People usually give it a week or 2 until they see someone, meaning they have been feeding their baby maybe 10 times a day. It's been painful, baby has been clamping down or hasn't been gaining weight. So then we needed to supplement. So then I recommend to see a specialist to just do a further evaluation, right? And from my own experience, if people then decide to do a revision, most of the time they really have very good feedback, right? They really notice things are much easier. Baby is more relaxed on the breast because baby can just get more milk out. The main thing is that with the tongue tie, they can't get the milk out properly. They can't move the tongue. They need to put in a lot of effort. They're exhausted after a feed. And
Mm.
they couldn't even get out everything they wanted. And so then 10 minutes later, they're like, by the way, I'm not done. But they just stopped feeding because they were so tired. And that often is really quite a bit of improvement. But we usually need to work a little bit more on the tongue and the healing afterwards, because this little wound, which is tiny in a newborn, right? It's like maybe as big as a little fingernail, if even probably half the size of a fingernail. It's really tiny, but it needs to be like massaged and kind of stretched every day, because otherwise it just heals right away. And then we're starting from scratch, right?
Oh, I didn't think about that. So
Yeah.
the parents are then massaging under the tongue?
Mm-hmm. Exactly. You literally go in and just rub that area, not a long time. And depending on what was going on, a little longer, shorter, more up, down, more left, right, more, you stretch the tongue up a little bit. And that's not something babies like in that moment. But usually if it's being done right before the feed, then you do it. And baby's like, what? Are you kidding me? And then you put the little one on the breast and they're okay. Right. And that's the idea. It's
How
not
long do they have to do that
2
for?
days. It usually the family sends in pictures with most doctors to just send an update, and then the doctors will just kind of look at it, because the healing of the wound, it changes a little bit in color, basically, right? Like what it looks like, and so based on that, you just want to make sure it doesn't heal too early. If it's healed in 2 days, then clearly it wasn't a full it wasn't done fully, or it just healed way too fast, and then you kind of wonder.
Oh, then you have to do it again to that for
Exactly.
them. Oh,
Which is rare. I mean, usually really the doctors here, they just really, and plus me, lactation consultants usually are in the picture. We're like, don't forget to stretch and to just keep this open a little bit. It heals quite well. I mean, in a newborn, I think a week later, 10 days later, you only see a little bit of like a white layer. It really heals. Everything in the mouth usually heals quite beautifully.
So one thing, and I was researching this, I saw, and I did not know this, that there are two places you can get an anterior release, they were calling it. I'm guessing that's the front of the tongue, and a posterior release. So is that meaning they're cutting in two places, or it's just the anterior that is tighter?
So the anterior release is more the front, the visible frenulum, meaning that it's the middle of the tongue, and it goes to the middle of the tongue. It's this really visible frenulum, basically, and it's more superficial in a way. It's done with a scissor or with a laser, depending on. Sometimes doctors have preference, but sometimes they just ask the parents what they prefer, and they give them the pros and cons of both. And the posterior is a little bit more underneath the tongue, like it's the back of the tongue. And sometimes when I feel in a baby, they're like, "Oh, they look fine. I don't see a tongue tie." I feel the depth of the tongue, and maybe it's just really, really firm or tight. And then if there's also breastfeeding issues, maybe the tongue tie needs to be released in the depth of the tongue, and then it goes kind of a little bit further underneath the tongue towards the back of the tongue. Yeah.
That makes sense. So is there an option, or what are the options if a parent wants to opt out of the tongue tie? Can they procedure like cutting? Is there like physical therapy or OT to help stretch it, or there's really no other remedy?
Yeah, that's the thing is really, unfortunately, with tongue tie, when it's there, it's there. It just doesn't go away. It doesn't grow out, and it can't really get stretched or anything. But, I usually tell people, first of all, just give it some time. We're not in a rush. There's no emergency. This is something we need to kind of mull it over and sleep over it, sleep on it, ask people, do some research online. And what are the issues? Is it baby is not really gaining weight? Is there pain? Can we maybe just work with other things? And so if it's, for example, and I say just because it's, it's not great if someone has pain with breastfeeding, but let's say there's just pain and the baby's gaining weight at the same time, and the parents really don't want to do a frenotomy, then maybe we use a nipple shield, or we pump a little bit more. I mean, these are all not great solutions, but at least it gives us some time, right? Yeah. And at the same time, seeing other people can make a lot of sense. So the people who are usually helpful are craniocecal therapists, osteopaths, baby osteopaths who treats children. Sometimes it's good to see a facial myo-oro therapist who is really just kind of focusing on what is the baby doing and are there any other issues. But when everything has been done, even maybe sometimes we go to a nutritionist, we see an allergist because the baby has been spitting up a lot, right? And maybe the mother has been cutting out dairy, and we still see all these issues, and none of that helps. Then usually you just know, what, we've done it all. A month later, maybe, and then people just go. They've tried everything else. Nothing was really working. And other parents are maybe more open and say, what, this is pretty obvious. We do see the tongue tie. We can see the baby can't even get the tongue past their lips, right? The tongue can't ever be stuck out. And there is clearly pain. Then some parents might go right away. And most of the time they see quite a bit of an improvement. But if not, then at least they know, what, we did that, right? So it's sort of like either you just start from the back, right? We start with like osteopath and all these people, and then move to the frenotomy as the last source, or you do the frenotomy first. Either way, for babies who've had the tongue tie a little bit longer, let's say maybe parents wait for 6 weeks and then see a specialist, it still makes sense if the frenotomy has been done to see an osteopath or craniosacral therapist afterwards, because the baby often has added on some more tension because of the tongue tie, and they can't just like let that go, right? Yes, they have the revision now, but then we need to retrain them, and that sometimes that makes it a little bit harder. We could have avoided that with the early frenotomy, but because it's not an emergency and there is no rush, I'm really a big fan of just waiting. And how do things evolve? Because some babies, after 4 or 5 months, we still have the tongue tie, but then the latch is good. The baby can open their mouth better because they are bigger. A baby is bigger and heavier. And there are later no speech issues. And then, we had the tongue tie, and it was difficult in the first 4 months, but whatever, right? We didn't want to do it. And now we're past that, right?
So how will a parent know? I guess it's really up to them. But do you think there's ever a point? I guess more I'm thinking like that heart-shaped tongue, like where they can't, I mean, so there must be a range, like one mouth you might look at and be like, this baby really needs it. And then others you're like, oh, it possibly could wait. Do you think that's more likely what's happening?
Yeah. If the thing is, there are some babies who have a total tongue tie, like up to the tip of their tongue, and everything looks really good. There's no pain, there's no issues, and then you're like, okay. Well, I mean, I know adults who walk around with a full tongue tie. Where it's funny when you see people like in my everyday life, right? And then I see someone and they talk normal, but then if you're in a certain job, right, you just like, you can't help it, but you keep looking at their tongue. You're like, how? Oh my goodness, this was never nobody ever did anything. It's really funny, but it depends on parents, feed, and if it's a full, we say 100% tongue tie, certainly I would say go in, because usually I came to see this family because there was some kind of an issue, right? But I know it's a process, and for some it's like, you know what, this is totally a no-brainer, we'll do it, and for others it's very anxiety driven and very emotional. Right. And I think postpartum, there's so much going on already, and that's why I really hated this New York Times article, because I was like, we are the only people who get invited to help postpartum families, and luckily now insurance does pay more for lactation consultants or also postpartum doulas, and then us who are being trusted, right? And we're not even enough people, basically. There's a really bad article. So now who should people even trust, right? Mm-hmm. And that's what makes things so much harder, because it's a very vulnerable stage, and families should be able to trust someone, and it's certainly the lactation consultant and pediatric dentist, because it's such an emotional topic. And I've never had anyone who pushed for this, even the dentists I like, ENTs I like. Nobody ever says, we've got to do this, right? There's just no question about that. It's more like, this probably will help and release your pain, but take your time, right? I'd say the only time when you really have to do it, and everyone would agree on this, is if the baby is just not gaining weight. And it's from that tie, there's so much tension that they like spit up all the time, and they're just crying a lot and just not happy babies. Then it's something
Do you know, is there any resource that people can go to look into this even more? Because I don't want to just send people to the internet and put tongue tie in, because you're going to come up with so much.
Yeah, the good thing is, I mean, tongue tie, if people put it in and you go to like websites like the American Association of Pediatrics, for example, or pediatric dentists, those resources are really good. I do like this book, Tongue Tied, in 2018. It's by Richard Baxter. That is a good book because he brought in all these evidence-based studies and really looks at the evidence and, what do people have and the pros and cons of, down basically throughout their life when they've had it done. And of course, mainly looking at breastfeeding.
Great. All right. We're going to take another break. When we come back, what is one tip or final piece of advice you'd like to offer new and expectant parents? We will be right back.
Save on O'Reilly Brake Parts Cleaner. Get 2 cans of O'Reilly Brake Parts Cleaner for just $8. Valid in-store only at O'Reilly Auto Parts.
O'Reilly Auto Parts.
We're back. So you come with so much knowledge and so many different hats in the birth world. I'm very curious to see how you answer this. So what is one final tip or piece of advice you'd like to offer new and expectant parents?
You need to agree on what you're doing. As a couple, or of course, if you're a single mom, very different story. First of all, you need to communicate what's happening. Take in all the information, like take your time. There is no rush.
That makes a lot of sense. Where can people find your work?
In New York City or virtually. I have a website called thenewyorkbaby.com, or Tuesdays I'm at the Prenatal Yoga Center. And I'm looking forward to hearing from people, or if any questions come up, of course, happy to answer them as well.
Thank you, Stephanie. You really helped unpack this whole conversation about tongue tie, this hot controversial topic right now. So thank you so much for educating me and educating the community. I'll see you in the studio.
Thank you.
Take care.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.